Hello, welcome to Proactiv, Pain, Rehabilitation and Innovation Clinical Research Group. This research group brings together academics and clinicians who work across the Royal United Hospitals NHS Foundation Trust and at the University of the West of England in Bristol. Our research and clinical interests are focused on children and adults with chronic pain. The disease conditions that we encompass cover neuropathic and musculoskeletal conditions. Our aim is to develop therapeutic approaches to improve treatment, rehabilitation and service delivery using high-quality, interprofessional research practices for the benefit of those with chronic pain and/or sensory motor impairments. Our research projects within Proactiv are divided up across 4 key themes. These are therapeutic approaches and innovation, health services research, mechanisms and measurement. We also have 2 cross-cutting themes which really cover activities in all 4 themes. So patient, professional and public engagement in research and psychological behavioural issues. So let's look at the themes in a bit more detail. In therapeutic approaches and innovation, we have a project looking to try and improve the care for people after stroke. Often people who've had a stroke report that the stroke-affected limbs feel very cold. Within our group, we're working to try and devise clothing that will help warm those limbs to see whether this improves the comfort for patients and perhaps help their function. Within this theme too, we're looking at new ways to deliver advice to people with osteoarthritis about how to exercise. Specifically, we're looking at multimedia approaches, such as an online patient interface, where they can get advice and support on how to monitor their activity and continue it into the long term. Within our theme of health services research, this focuses very much on looking to see if there's new service delivery models. Within this theme, we're looking to see what role physiotherapists can play within primary care practices to try and help people with osteoarthritis-related pain. Within our mechanisms theme, we're interested to explore the drivers behind people's experience of their condition or the pain in particular that they're suffering. This covers a wide range of different methodologies, but in particular we're looking to see what role visual illusions may have in altering people's perceptions of their body by looking at the changes that happen as a limb is artificially altered in perhaps size, shape and colour using visual illusion technology. We're interested to see also what happens within the brain as we do those approaches. Again, within mechanisms, we want to see what happens to stroke patients in terms of ankle impairments. When we look at the measurement theme, it's very much focused on capturing changes in patients' or health professionals' behaviours or signs and symptoms in a condition. Within this theme specifically, we're looking to see how the acceptance of shame and embarrassment can be captured in a questionnaire. Within our team, we also do a large number of international projects as well as national and more local studies. One of our international studies within the measurement theme has been to develop a core set of outcome measures for people who are experiencing a condition called complex regional pain syndrome. By having this core set of outcome measures, we can now conduct international studies collecting all the same data so we can compare and contrast different patient populations and conduct large multi-centre studies. Then let's move to our cross-cutting themes. Within our research, we're very keen that we always have patients as active research partners in all of our projects. So within our patient, professional and public engagement research theme, we are making sure that this always happens and to look to see how we can disseminate our research to the key people involved. That may be commissioners of healthcare services, patients or other healthcare professionals. Within this theme, we also have some research projects. One of these research projects is looking to see how providers of services for people with musculoskeletal conditions use the research evidence in order to inform the commissioning of services. Finally, within our psychological and behavioural theme, you will find concepts related to psychological studies across all of our Proactiv research themes. The vision of our research group is to see all aspects of rehabilitation research as potentially having a psychological and behavioural aspect, rather than seeing this as a separate topic. Unlike the other themes where there are studies specifically about psychological variables and treatments, we will just make sure that within each of our themes, we're always considering this important aspect. If you'd like further information about the research that we conduct, please have a look at the remainder of our website, where we have the contact names and details of all of our researchers involved within Proactiv.